Welcome to the EVS team at Quality Janitorial Group. We're glad you're here. Today, we're going to walk you through what it means to be an environmental services EVS technician in a medical setting. You are a crucial part of patient care. Without you, the healthcare environment wouldn't be safe, clean, or functional. Let's dive into your role and how you make a difference every day. As an EVS technician, you're responsible for ensuring the healthcare facility is clean, sanitized, and safe for patients, staff, and visitors. Here's what your daily work may include: cleaning and disinfecting patient rooms, hallways, restrooms, operating rooms, and high-touch surfaces like door handles and bed rails. Waste management, safe disposal of regular trash, sharps containers, and biohazardous waste. Floor care, sweeping, mopping, buffing, carpet and mat care. Restocking, making sure supplies like soap, gloves, and paper towels are always available. Collaboration, working with nurses, doctors, and other departments to coordinate cleaning in patient care areas. Cleaning in a hospital or clinic isn't like cleaning anywhere else. It's about infection prevention. Always wear PPE, personal protective equipment, gloves, masks, gowns, or face shields as required. Use approved chemicals only. Never mix chemicals, and always follow the product label and dwell time, how long the disinfectant must stay wet on the surface. Follow your cleaning checklist. This ensures no surface or step is skipped. Work from clean to dirty. Start with areas like overbed tables and work your way to bathrooms or trash bins. Change tools between rooms. Use a fresh cloth or mop head for each room to avoid cross-contamination. Dispose of waste correctly. Know the difference between regular, recyclable, and biohazard waste, and where each one goes. Next, you will watch a video demonstrating the proper cleaning steps, policies, and procedures in a healthcare environment. These steps may vary slightly depending on the specific facility you're assigned to. Your supervisor will provide site-specific instructions and guide you through any variations based on hospital protocols or department needs. Please pay close attention to PPE usage, surface disinfection, waste disposal, and order of operations during the video.
Training program on best practices to use when cleaning and disinfecting patient rooms. Cleaning and disinfecting in healthcare facilities, including hospitals, clinics, long-term and residential care centers, requires environmental service workers to have specialized training. Individuals with specialized training may have titles such as environmental service technicians, EVS workers, or housekeepers. In addition to specialized training, the healthcare EVS workers should be able to demonstrate competency. This means being able to show your supervisor or trainer that you can perform the practices correctly after being trained. Healthcare facilities are different than other kinds of businesses when it comes to cleaning and disinfecting. The reasons for this include: bad germs in these kinds of places are more common. The germs are often difficult to remove or kill. The germs are invisible, which makes it very hard to know if you have been successful in your cleaning practices. Patients and residents who stay in hospitals and other healthcare facilities are often ill, elderly, and debilitated. This makes them more likely to catch infections. Patients also have many more chances to be exposed to the germs that are found in their surroundings since they have frequent contact with healthcare workers. One fact that you need to know is the hands of healthcare workers are the most common way that germs can travel around medical facilities. Meet our friend Anna. She is an EVS worker. Some people may think of her as a maid or a janitor. Although those jobs are important, a healthcare EVS worker is different than both of those. It is her job to clean, disinfect, and prepare the environment in the facility so that it is safe for patients, visitors, and staff members. Anna has been trained by her supervisor how to properly clean and disinfect patient rooms. Anna had to demonstrate the proper techniques she learned before she was allowed to work independently. Anna is ready to clean this patient room. The patient was sent home today, so now she needs to make sure that the patient's room is properly cleaned so that it is safe for the next patient. This will prevent the transfer of any germs left behind from the first patient to the next new patient who will be occupying this room soon. Anna will begin by making sure her EVS cart is properly supplied and neatly organized. Clean things are physically separated from dirty items such as trash or used cleaning cloth. After her cart setup is complete, she performs hand hygiene, applies her disposable gloves, and goes into the room to remove the trash and soiled linens. Next, she removes her gloves, cleans her hands, and applies fresh new gloves. Then she begins to clean, making sure she is going from top to bottom, cleanest to dirtiest areas. Then she moves in a clockwise, counterclockwise fashion around the room. This helps her to clean all items that need cleaned and also to prevent her from cross-contaminating areas and items in the room. Anna folds and refolds her microfiber cleaning cloth that is dampened with the approved disinfectant as she moves around the room cleaning. This process also helps prevent cross-contamination by making sure the cleanest portion of the cloth is used as she cleans. Use of microfiber cleaning cloths is considered a gold standard in healthcare environmental cleaning by infection control. The technology of microfiber cloths greatly increases the germ removal ability over non-microfiber rags. Anna changes her cloth frequently when needed and never touches a dirty area of the room with the same cloth that she will use to clean a less dirty area. She will clean the bathroom last, since it is considered the dirtiest area of the patient room. In the bathroom, she begins with high to low cleaning and then moves from the cleanest area. For example, that includes the sink toward the dirtiest one, which is the toilet. The last thing she will do after cleaning and disinfecting the toilet is to mop the floor with a disinfectant. Anna has a very specific routine when she cleans, which was taught to her by her trainer. This routine will help assure that she doesn't miss areas or contaminate areas when she's cleaning. Remember, the germs that Anna is working to kill are invisible, so it is important that she follows the facility policies and doesn't miss any steps when performing her cleaning duties. Some of the main things to remember when cleaning and disinfecting include the following. You should use an EPA-registered hospital disinfectant cleaner when cleaning in healthcare. Follow the manufacturer's directions for dilution, labeling, and expiration date. This includes when filling your pails, bottles, and other containers. Often these directions include the use of chemical mixing stations or specialized measured pump bottles located in EVS work closets. For your safety, always be sure to wear the proper PPE such as gloves and eye protection when filling your containers with cleaning solutions. Never top off cleaning disinfectants. Instead, only add new cleaning disinfection solution to the empty, clean containers, as this is considered best practice for infection control reasons. And last but not least, you should know the name of the product and the contact time required for the disinfectant to do its job. This is found on the product label. When you perform surface cleaning and disinfection, take care not to apply too much liquid to the surface being disinfected. The excess moisture can promote the growth of unwanted organisms, including molds, and the excess liquid can be destructive to the surfaces being cleaned. Make sure that your cleaning equipment is cleaned daily when you finish, and it's in good working order. You should clean and disinfect mop handles and similar equipment at the end of each work shift, as well as when exiting from patient isolation rooms. Worn out equipment should not be used. You must remember that dust is not our friend in healthcare. Dust carries germs through the air, in the air currents, and can increase the risk for infections. Our goal is to prevent dust movement during the cleaning processes. You should never use dry methods such as feather dusters or other dry high-reach types of equipment to clean and dust in patient areas in healthcare. Instead, use a damp dust method. To do this, the cleaning cloth, microfiber mop, or microfiber duster is dampened with the approved disinfectant, and then the surface is damp wiped clean. Remember to dampen, not saturate. Also, don't forget to use friction when cleaning, as this is very important in the germ removal process of cleaning in healthcare. Other approved methods of dust removal in the patient care areas include the use of HEPA-filtered vacuum equipment. And don't forget, a very important reminder, once you have finished your cleaning task, you should remove your disposable gloves and perform hand hygiene every time. Often healthcare workers forget to clean their hands after removing their gloves. Those responsible for cleaning the healthcare environment are the foundation of the facility's infection prevention and control program. Thank you for what you do as a healthcare worker to make the environment where you work a safer place. Remember that by following these best practice instructions, you can make the patient and resident care areas cleaner and safer for them, as well as the visitors and staff working at the facility.
Your work helps prevent healthcare-associated infections, HAIs. Infection control is everyone's job, but you're on the front lines of keeping patients safe. Follow universal precautions. Treat all bodily fluids as potentially infectious. Be aware of isolation precautions. You may see signs like contact precaution or droplet precaution. These mean special steps are required. Use wet floor signs and proper lifting techniques to avoid accidents. Know the location of eye wash stations, spill kits, and emergency exits. Report any needle sticks, injuries, or unsafe conditions to your supervisor immediately. Next, you will watch a short video on the proper way to wear disposable gloves. Gloves protect both you and the patients from the spread of germs, but they only work when used correctly. This video will demonstrate how to properly put on Don gloves, how to remove doff gloves without contaminating your hands, when to change gloves during a task. Remember, gloves are not a substitute for hand hygiene. Always wash or sanitize your hands before and after glove use.
By washing them with soap and water, or by applying an alcohol-based antiseptic hand rub. Touching only the cuff, take the first glove out of the original box. Try to only touch the wrist area of the glove. In other words, the top end of the cuff. Don the first glove by sliding it over the fingers, palm, and wrist. With the bare hand, take a second glove from the box, again only touching the glove's cuff or wrist. Turn the external surface of the second glove on the folded fingers of the gloved hand. Then, glove the second hand while being careful not to touch the forearm skin with the gloved hand. With gloved hands, the healthcare worker should not touch anything that is not indicated for glove use. Proceed with performing the intended procedure, such as examining a patient or drawing venous blood. Project 3D: How to safely remove used gloves. One has to follow specific steps when removing used gloves to minimize the chances of cross-infection. Pinch the glove at the wrist level and pull it some distance away from the skin without touching the skin of the forearm. Peel the glove away from the hand, thus allowing it to turn inside out. Hold the removed glove in the gloved hand and slide the fingers of the ungloved hand between the glove and the skin of the wrist. Remove the second glove by rolling it down the hand and folding it over the first glove. Discard the removed gloves in a suitable biohazard waste bag or bin. Perform hand hygiene.
Cleaning in a hospital or clinic isn't like cleaning anywhere else. It's about infection prevention. Always wear PPE, personal protective equipment, gloves, masks, gowns, or face shields as required. Use approved chemicals only. Never mix chemicals, and always follow the product label and dwell time, how long the disinfectant must stay wet on the surface. Follow your cleaning checklist. This ensures no surface or step is skipped. Work from clean to dirty. Start with areas like overbed tables and work your way to bathrooms or trash bins. Change tools between rooms. Use a fresh cloth or mop head for each room to avoid cross-contamination. Dispose of waste correctly. Know the difference between regular, recyclable, and biohazard waste, and where each one goes. You'll be working around patients, nurses, and doctors. Communication matters. Always be professional and respectful. If a patient asks for help, politely direct them to a nurse or appropriate staff. Check in with nursing staff before entering rooms where procedures may be happening. Ask questions when unsure. We're all here to support each other. You might not wear scrubs or carry a stethoscope, but you save lives too.
Here's how.
A clean room reduces infection risks for every patient. A tidy, welcoming space helps patients and their families feel safe and comfortable. A sanitary environment boosts the morale of the entire healthcare team. Your attention to detail can stop an outbreak before it starts. You are essential, and we value your hard work every single day. Next up, handling biohazards.
Our workday, we touch a lot of surfaces, some of which might be contaminated. Millions of workers every day are at risk from contaminations called blood-borne pathogens. Blood-borne pathogens are present in infected human blood and certain other bodily fluids, and some of them carry potentially fatal diseases. No matter what kind of work you do, you should always be aware of the risk of exposure to blood-borne pathogens, because when you know the risk, you can take precautions. You can be exposed to a blood-borne pathogen by touching an infected person or their secretions, or you can be exposed by touching something that has been contaminated by an infected person. So how do you protect yourself? You have to understand that something can be contaminated and the infected organism may not be visible. For example, linens, tabletops, washrooms, door handles, anything that may have been used or touched by someone else can spread a dangerous germ or virus. When you come into contact with an infected surface, the organism can transfer to you. Once it is on your body, any body opening can allow this pathogen to enter your system. This includes your nose, mouth, eyes, other body openings, any mucous membranes, and any cuts, abrasions, or any other breaks in the skin. For example, if an infected person coughs or sneezes on a table which is not cleaned after use, and then you touch the table with your hands, the infection may now be on your hands. If you rub your eyes or eat anything, the infection can pass into your system. This can be prevented by following simple guidelines that will protect you from exposure. You don't know if someone with a contagious disease has touched a surface, so good hand washing is the first and most effective method to prevent spreading infections. Always treat blood, body fluids, broken skin, and mucous membranes as if they were infected, and use proper gloves before cleaning anything that may have been exposed. Wash your hands before putting on gloves and immediately after removing them. If soap and water is not available, you can use a waterless hand sanitizer. Never touch clean objects with contaminated gloves, and avoid touching your face, eyes, nose, or mouth until after you have washed your hands. Protect yourself from blood-borne pathogens, use appropriate disinfecting agents, and use proper hand-washing techniques. Thanks for watching.
Let's recap. Follow cleaning protocols carefully. Every step in the cleaning process matters. Whether you're disinfecting a patient room, handling waste, or restocking supplies, it's essential to follow your checklist and use approved chemicals correctly. Consistency is key to preventing the spread of infections and ensuring a safe environment for everyone. Always wear the proper PPE. Understand and respect infection prevention rules. Communicate clearly and work as a team. Take pride in your work. You are a critical part of the care team. Thank you for completing your training and for joining our team. We're excited to welcome you to the Environmental Services team. Your role is essential in creating a clean, safe, and healing environment for everyone who enters the facility. As you begin this journey, know that your contributions matter and your efforts are deeply valued. If you ever have questions, need support, or want to grow in your role, we're here for you. Welcome to the team. We're glad you're here.